What can you tell us about this report, Zara?
Well, Colette, it's a very interesting report, 37 pages. I suppose there's a couple of details in it in terms of access to IT being one example, that the systems don't speak to one another, that a lot of the paperwork is it's handwritten, it's not happening on computer systems. Also talking about children who are going on medication, they're being described as being lost in the system, and that there is actually no follow-up in those cases. So a lot of very concerning details in that. One of the recommendations in the report, we can take a look at that, is saying that an immediate clinical review of all open cases in all CAMHS teams, with particular focus given to identifying and addressing open cases of children who have been lost to follow-up, and physical health monitoring of those on medication. So that comes from one of the details in the report, Colette, in which they are saying that those open cases, a significant number of those requiring regular follow-up, that is not actually happening. They're also saying that some children are taking medication without appropriate blood tests, and as I say again, that physical monitoring. Berg Grogan is with the Mental Health Reform Group, and she's been giving us her reaction.
We were really, really disappointed and really concerned and worried seeing the report this morning. It's really unacceptable, and it's a damning indictment of the persistent underfunding of our services and the lack of clinical oversight across all of the CHOs. There is good work being done in areas. There are supports available, and if anyone is feeling in any way distressed or upset themselves, just to reach out to whatever help and supports are available. That just because we hear the bad news and the upsetting reports, it's not hopeless.
So, Colette, a number of challenges, I suppose, in relation to even things like staffing and trying to fill the teams, because one of the points in the report is that care plans are either absent or poor in many teams, and there are no practice managers. And in general, teams are operating at around 50% of the recommended administrative staff, so it's only halfway there. In a statement, you can take a look at that from the HSC. They're saying that this Mental Health Commission report comes at a time when we have a major CAMHS improvement process underway, and we will be putting a senior clinical operations team in place to drive and support that process. And then they go on to say that this interim report, as well as the current prescribing review and other ongoing HSC audits in CAMHS, combined with the service improvement work underway, will all contribute to this process.
All right, Zara, thank you very much for all of that.